Hello, Dr. Renee here, and welcome back to my channel. I'm super excited today to bring you part two of a two-part interview with Dr. Shawn Talbott. Now, this is actually one interview that I broke into two separate videos for YouTube and actually two different episodes for my podcast, because my goal on all of my platforms is to keep it under 30 minutes so you can actually have implementable, tangible tips to carry you on through your day, through the week until my next video comes up. So Dr. Shawn Talbott is a psychonutritionist. I'll put his full bio below in the comments. But we touched on so many things again in this interview. We touched in this particular video on different strains of probiotics for stress and anxiety. And yes, they have been scientifically proven to help with stress and anxiety. We touch on fiber. We talk about the difference between immune system stimulation versus priming. And, we talked about strategically using supplementation when your nutrition's not quite there yet, because I deal with a lot of people who are very stressed and they turn to different foods to help with their stress. Well, sometimes you need to use supplementation to get you to feel better in order to eat better. So we touch on all those topics in this video. So without further ado, let's just get into it. Yep. And I did not know that. I mean, I love to say how much education I have. And I mean, I'm intelligent. I know lots of things, but what I did not know was that there were actually specific strains of probiotics that have been scientifically studied to improve mood, anxiety, stress resiliency, help you with calmness. And I mean, you look at the back of any bottles and you don't see that. I mean, I had another probiotic in my fridge and I turned it over. I should call the company and actually ask them, because
you should. That'd be really fun conversation.
Strains? Yeah. Because I've never seen that on. I mean, it's an A and like the four numbers right after it. I was like, wow, I've never seen that before. So
Most companies have no perspective on that. That concept is something we call strain specificity.
Yes.
That, it's not just any probiotic, gives you benefits, and not just any lactobacillus or not just any lactobacillus acidophilus. You really have to go down to the strain level in order to determine what benefits, if any benefits, you're going to get from that particular supplement. So, and that's something we really didn't have a good perspective on, 10 years ago, and I think companies are starting to get on that bandwagon. But, at Amare, we can say we chose this strain because it helps with mood. And we know that it helps with mood because we can dial it back to its mechanism and show it helps with serotonin metabolism in the microbiome. Or this one helps with stress, and we can show that it lowers stress hormone like cortisol, and it increases a relaxing neurotransmitter like GABA. Like, it's getting to that level of specificity. And we're certainly on the forefront, but I think the whole probiotic space is eventually going to change as they sort of catch up to where the science is.
And I really think people just go to the store and they just pick one off the shelf, or they go to the vitamin shop and say, which probiotic? Oh, what do you want? One refrigerated, none, and it's very non-specific how many colony forming units to get, the mega, the super dose,
and then people, like, just the way you're saying it, right? You probably have patients all the time. You're like, well, I chose the one that had the most, that had the highest number on it is the one I chose.
Exactly.
And you're like, oh my gosh, that doesn't tell you anything.
Yeah. Or I went and asked the girl at the front desk and she just went,
She said this one was buy one, get one free. So that's the one I got.
That's usually how it was. I mean, it's really... and I did have one person that wanted me to ask you specifically, because she has started the products with some mental wellness hopes in the near future, because she has two autoimmune conditions.
Okay.
And what has miraculously happened in about a week of starting the products is that her symptoms have, and this is a girl that's like maxed out on meds. She's getting IV in immunoglobulin, like infusions, and like prednisone, and just really mentally feeling defeated too, because her physical symptoms are so bad. And started the products, and honestly, I thought it was too good to be true. I want to say within days, all of a sudden then she came back, she went on vacation, and she's cutting down on medication because she's finding, I think her absorption's better of her, and I don't think people understand, oh, I'm taking turmeric or curcumin for my inflammation, but it doesn't work. Well, maybe you're not absorbing it.
Right.
And I think, she was the one, because she's had such amazing results with the products. And really think, I know you guys don't come from an autoimmune, but I know there's a lot of testimonials with people with autoimmune diseases.
Yeah.
That, again, you get their gut healthy. so many things improve,
Yeah.
absorption of their medications, maybe cutting out their medications, right up to the mental wellness part. But, talking, kind of looping back about the immune system, there's been a lot of talk, I think they're getting confused with autoimmunity and the whole stimulating versus the priming.
Yeah.
I
And
think
that's a very nuanced sort of difference between what priming is versus what stimulating is. So stimulating your immune system would be taking your immune system from either low above, and then stimulating above normal, or taking it from normal and stimulating it above normal. So stimulating is taking your immune system into overdrive. And that could be an appropriate thing to do, but in a very, very limited situation. Like if you are infected, right? If you the first day of a cold, you get that scratchy throat, or you get that little, back of your nose sort of congestion, that kind of stuff. You're infected. If you stimulated your immune system for 3 or 4 days, that might be a good thing. But that's it. No longer past that, because if you keep your immune system in that stimulated state, the risk is you get some of these autoimmune system conditions, right? Where your immune system now, like once that thing that it's supposed to fight, that virus is gone, now your immune system is just going to fight whatever it can find. And that sometimes can be your skin, it can be your mucus linings, it can be your cartilage, it can be your connective tissue. It can be lots of things. So you don't want to keep your immune system stimulated for a long period of time. Priming is different. So priming will take you from low back up to normal, but priming can also take you from overactive, like if you have allergies or you have autoimmune system conditions, and that brings you down to normal. So when I describe that to a lot of people who know sort of herbal medicine, they go, "Oh, that sounds like what's called an adaptogenic response." Yeah. So you're saying it the same time I'm saying it. It's that's exactly.
You're adapting. You're doing what it needs to do.
Adapting to where you need to be. Yeah. It's like it's modulating. It's bringing you back to that balance point.
So I'm wondering, even, because a lot of the products that you discussed on the webinar that you can use every day is not necessarily for stimulating, it's for priming and just keeping your immune system really just basically ready to go if needed. Not to the point where it starts attacking, but ready to go. And that might be why she's feeling so much better. It's just miraculous how quickly it happened.
Yeah.
I'm really impressed. I'm really impressed. And
it's a really, really cool effect. And it's coming from these natural ingredients, but I'll tell you where we learned it from. The beta glucans and alpha glucans that have the best research around them are the actual ones that we have in our products. But those companies that we license them from have complete other platforms where they're using those same exact compounds, but in an injectable or an infusible form as anti-cancer therapy, right? So those are on the trajectory to someday become natural chemotherapy drugs. And because they're natural ingredients, we can ingest them and we can get the same sort of immune system vigilance naturally, So it's really, really cutting edge science that we're able to apply to something, like what's happening to everybody today.
Yeah. I mean, again, across the board, I don't think, again, coming out to California, learning mental wellness, I have to admit, before I came out, I'm like, well, you talked about like this, maybe not you, but one of the people that spoke talked about like this stigma with, I don't even want to say mental health, but maybe, and I actually, coming out being the mental wellness company, I was like, oh, well, I don't really deal with that. And then I had to sit back. I'm like, oh, yes, I do. Every single day. I had patients and clients dealing with stress, anxiety, fatigue, burnout, you name it. It doesn't necessarily have to be always depression, anxiety. It's just some sort of like not feeling well, and usually mentally. And, even if you physically don't feel well, it always goes up to the brain also, you mentally don't feel well. And it's usually starting in the gut.
Yeah, exactly. The people that I think have the biggest revelation are the people who think they don't need this, right? They hear mental health and they immediately think, when people hear mental wellness, they think, oh, depression, anxiety, burnout.
Exactly.
I don't have that. That's not me, But then you ask them, well, do you have stress in your life? And people just laugh, right? They're like, well, of course I have stress in my life. Do you get 8 hours of sleep every night? And of course nobody does, so that's a level of stress.
Yep.
If you're not eating a perfect diet, that's a level of sort of nutritional or dietary stress. The air we breathe, the water we drink, like you can go on and on and on and sort of tick off all these all these stressors that are around us 24/7. And then you ask people like, do you have as much energy as you want every day? Are you able to relax and get a good quality of sleep every night? You know, how's your brain fog? You know, and then finally people go, maybe I do need to try this. All right, I'll try it. And then when they get the benefits of that resilience coming back in their bodies, they go, oh my gosh, I had no idea. You know, and that person becomes a convert, and they tell everybody that they know.
I agree. And, you know, I'm on it. My family's on it. My husband, who's usually the biggest critic, he's, you know, he was like, okay, when can I start on it? Like he, you know, he's a doctor, conventionally trained like myself, but he has to stand back a little bit longer before he actually jumps on anything. So
yeah, you just described my wife. She's that person. She's that very like, I mean, very skeptical kind of person. And I tell this story sometimes. So I mixed up, I have a laboratory in my house. So I can make up, you know, all these, you know, blends and things like that. And I have a capsule press. And
I was wondering how you do it all.
Oh my gosh. So, my poor kids, my kids are 18 and 21 now, but since they were little tiny toddlers, I've been having them try things, and, you know, and they'll see me working on something like, Dad, do we have to try that? You know? So anyway, long story short, I made up two of our initial Amari formulas. One called Mood Plus, which is like for stress and for mood and for resilience and that kind of stuff. And the other one was one that we call Relief Plus, which is an anti-pain product. And I mixed them up. She was having some low back pain, so I put the capsules in these little Tupperware containers on the island in our kitchen.
Here's the mad scientist in his
really. Yeah, totally. And I was like, that one's for pain and that one's for mood. And don't get them mixed up. They look very different. One of them's bright orange and one of them's kind of brownish. And within about a half a day, she had taken the Relief product, and she kind of looked at me and she went, I think this is working. Is this working? And I was like, honey, I can't tell if it's working for your pain. That's a very subjective thing. You need to tell me. And she's like, I think it's working. You know, I'm like, well, sorry that it's working for you, you know, but she came at it from that perspective of like, I don't want this to work almost, right? Because she didn't want to, you know, get into that whole, you know, placebo response and all that kind of stuff. So she came at it with this very, like almost pessimistic perspective, and it worked for her, you know? So like, and I love it when people come to it with that perspective of, well, let me be the judge of that. And we, you know, we invite people to do that every day.
Yeah, I agree. And, you know, again, I don't force people. I just offer, because it changed my life and my family's. And the other interesting thing that I didn't even know, I learn something new every day. I love this. I love learning. And when I had personal testing done in December on my gut, speaking of gut, and I think this is why I've become so passionate, because I was feeling burned out. I wasn't feeling good. And I'm the doc. I'm the doc that helps people with all these things, right? And I was the doc that really
did. Well, you know that docs are some of the most of all the professions in terms of burnout. Yeah. Because you're always giving and you're always helping and you're always bringing other people up, you know?
Absolutely. Yep. Yeah. And I didn't really focus on gut health. So when I got some stool testing done, I went and got the test and I looked through all the literature and I'm studying. I was like, oh my gosh, it's not that I have an overgrowth of bad bacteria. I didn't have enough good. And I had essentially zero butyrate, like no butyrate. And knowing what I know now, I was like, oh my gosh.
Yeah.
You know, and, you know, butyrate is produced. And the other thing is I was like the 97% of Americans not getting enough fiber. Right. Because what would happen is I would have fiber and I would be one of those people like, I need more fiber. So I would just fiber myself to death. Veggies, you know, psyllium husk, you name it. I was putting it in and I'd get bloated.
Yeah.
And like most women, we do that because we like, it's all or none, right? We do it. And then I'm like, oh, now I look like
I don't like that.
Pregnant. Then you stop, right? And come to find out, you know, some of the good bacteria that actually need that fiber, I didn't have.
Right.
You know, and so I wasn't digesting it and, you know, it's probably way too much. So now I say little bits at a time increase but what people don't understand is that, you know, yes, we have good and bad bacteria in our guts. It's not always an issue with having too much of the bad. Sometimes you just don't have enough of the good.
Right. Exactly. And if you're not getting the fiber, you're starving the good guys. They don't have the fuel they need to grow.
Yeah, absolutely. And then, you know, cravings, you know, and I was having, you know, lacking. Yeah, it was a whole big mess. Like, in other words. So I am so grateful. I'm on 2 different probiotics now. Like I'm getting my fiber in. Like I am like, people think I'm a zealot now. I'm like talking all about gut health, but you know what?
I was in such a bad place,
Yeah.
and I truly was my gut. And like, I'm so
Yeah.
much happier now and more energy, and my skin everything looks better.
Yeah.
You know, it's just,
that's like what you just described as vigor. When you can,
Yeah.
when you can take somebody from that low vigor or high burnout, however you want to say it, and bring them back to that normal state of high vigor, it is the coolest thing to see, because
Yeah.
they feel so much better in all those different ways. Because if your gut is right, so here's how, we started off talking about like, how to explain this science to people in a really easy way. So I was giving a microbiome seminar somewhere, and I was talking about, if you get your gut right, it's going to make you feel better in all these different ways that we can measure your depression and your anxiety. And, because if you get this bacteria higher, you make more serotonin, and that makes you happier. If you get this other bacteria higher, you make more dopamine, and that makes you more motivated. And I went through the whole thing, and there was a guy sitting in the front row, and he kind of whispered it to himself, but he was right in the front row, so I could hear him say it. And he said, "Oh, it's like having an internal pharmacy." And I stopped right in the middle of my presentation. I went, "Could you say that again?" And he said it louder so everybody else could hear it. I was like, that is precisely what we're doing. That if you get the right microbiome, now you make what you need when you need it. If you're stressed out, you make more GABA. If you're sad, you make more serotonin. So now you're happier, and et cetera, et cetera. And then you feel better in all those different ways when it is required.
And what I didn't know also was that, I'm a big person talking about adrenal fatigue, because I personally had it, 5-6 years ago. And that's how I got into functional medicine. I was misdiagnosed with depression, and I was like, I just don't feel like depression. And it was AKA burnout, right? I was burned out. But most recently last year, my cortisol was really low, and I'm like, why is this happening to me again? And I really didn't know that the gut really could do that to my adrenals. Like, I always thought it was the stress, but it was my gut that was stressing my body. It's like my poor gut health on so many levels.
Right.
That was really stressing my adrenals.
What it could have been too, which I'm sure you're very well aware of, but just to say it for your listeners, is that, you get into that, adrenal fatigue situation where, your adrenals and your cortisol overload in the early phases of your high stress might have caused those gut problems, but now those gut problems are causing these other systemic problems. So, in terms of your immune system and your energy levels, and you've always been a very fit person, and so like, maybe your body fat went up a little bit, maybe your muscle mass went down a little bit. And like, those are not things that you want to do when you're as fit as you are. So, those kinds of things, like when I wrote my first book about stress and vigor 20 years ago, we knew hardly anything about the gut microbiome. And so all of our interventions back then were about, well, let's focus on the adrenals, let's focus on the immune system, let's focus on your inflammation. And, and those were effective as we could be back then. But now we have this whole new set of tools around the gut and around the microbiome that are just accelerating the benefits for everybody.
And it's funny you said about the adrenals and the gut. I was wondering, like, what came first? It could have been
right. Who knows?
Yeah. And I kind of blame my bodybuilding years on I was a bodybuilder for a couple of years, and between the nutrition part and the stress part on your body, between the physical, I mean, you're an athlete, sometimes being overzealous with your activity is not always great for your gut health or physical health. Right. So I think, it's kind of in retrospect, like could have, would have, I'm happy I had those parts of my life, but now I'm sort of repairing all of the damage. But look, I'm here today, sitting here with you and talking about gut health. So, and how it can affect the entire
everything
body.
happens for a reason, they say.
I know. And one last question. Where was my question for you? Because it was very pretty. What is one thing that you've done for your health that you feel was a total game changer? Because I know you've probably done a lot, but what was that one thing?
Yeah, I'll tell you what the one thing is. And I've been preaching about this for years and years and years. And I would say it's probably in the last 2 years that I've really done it for myself, right? You're maybe not. You've been in the situation as like the expert of like, do as I say, not as I do, kind of a deal. I would tell people all the time about, if you're not getting the right amount of sleep, if you're not getting 8 hours, if you're not getting especially good quality sleep, your cortisol levels are higher. That's going to lead you to have more sugar cravings. It's going to have more belly fat. It's going to suppress your immune system. You won't recover as, but I was kind of still in that mentality of I need to do more, and sleep is the thing that I can do with less of. And over the last couple of years, I've really, really focused on my sleep. And I mean, so much so that like I wear sleep trackers and I measure my heart rate variability to see how I've slept the night before and all that kind of stuff. And I'll tell you what, it is a game changer for me. Like if I can just get that extra hour of sleep, I probably get 2 or 3 more hours of improved productivity the next day. You know, it's like amazing. You really can't do without it. You know, so I mean, so much so that I tell people now, like, hey, your exercise is really important leg of the stool. Your nutrition is a really important leg of the stool, and your sleep is equally important as those two if you want to be sort of overall fit and well and, you know, resilient.
So maybe work on sleep, number 1, right? And then one last thing I want to say that you've taught me is on my 5 years of, you know, being, you know, 20 years in medicine, OBGYN first, and then functional medicine, I think I've had this progression of how to help people and where to start. And I never really knew, like, where do I start? And most recently I thought, okay, well, maybe I can't get people to move their bodies or eat right because they're not in a right frame of mindset, right? So we got to start with the mindset. And then sometimes people aren't even ready for mindset. They're not there yet. So, you know, what I think we share this is sometimes you've got to start some supplements like we have, get them feeling better so their mindset gets better. And then, you know, it may not be the first one thing we want them to do. Like we wish they would have exercised and eaten better in the beginning, but we just have to get them over that hump of like, okay, let's get you feeling better.
Yeah.
Let's get your brain feeling better. Oh, wait, you're thinking, you're happier. You're in a better mood. You're more focused. Oh, wait, now you want to exercise. And now you might want to eat better. And
you know, along those lines, I always, so 20 years ago when I wrote my first book, I was very much, along the thinking of supplements are the last piece of the puzzle, right?
Yeah.
Let's get people's stress resilience good. Let's get them exercising. Let's get their diets dialed in. And then we'll use supplements as the last thing to sort of bring it all together.
Yep.
And now 20 years fast forward, I think exactly what you just described. Let's use the supplements first so that we can get their stress lower. We can get their resilience higher. We can get them thinking better. Yep. And then all of a sudden, you know, they are sleeping better, they are eating better, they are exercising more because we got them over that hump. Just like what you said is a brilliant way to say that. If we can get them feeling a little bit better, they start making those choices that we want them to make in the first place. So
honestly, this was you. This is how I came to my revelation, because I was always that person that supplements last. Like and now working my way backwards and working with people for 20 years and watching how people behave, including myself, it's like sometimes you just need to get over the hump, feel better, and then it all falls in place little by little. So thank you for that, because you said something. I was like, you're right. Sometimes we do have to start at the end and then go where we really want people to go, but they eventually get there on their own terms at their own will. So yay. Well, thank you so much. I don't even know how long we've been talking, but good, solid 45 minutes.
All right. Absolutely. My pleasure.
Thank you so much. And I probably will ask you to be on again in the future. Don't worry, it won't be next week. Although I'd love to talk to you again next week, but I'm sure we're going to have many more things to talk about in the future, especially as more things come out and we learn more about the gut health. So,
well, anytime. I love talking to you. So just, hit me up whenever the time is right.
Well, that's it, folks. I hope you enjoyed this interview with Dr. Shawn Talbott. I'll put his contact information below. Go check him out. And as usual, I would love to connect with you on any of the social media platforms. I am Dr. Renee Wellenstein. And if you enjoyed this video or resonated with any part of it, please leave a comment below. As usual, subscribe if you love information on holistic health, including information on gut health. And go ahead and share this video if it resonates with someone else in your life, maybe that's struggling with gut health issues or mood issues. And I thank you for watching, and we'll see you next week.